Hello and welcome to this video that will overview marriage and family systems. I'm Kristen Kinsevich, a doctoral student at Regent University in the Counselor Education and Supervision program. This video will cover marriage and family systems theories, specific issues related to marriage and family, and Christian integration themes. The material is adapted from Yarhouse and Sells, 2017. These are the summary of the different marriage and family systems theories that we'll cover. There are 10 that we'll discuss: Bowenian, strategic, structural, experiential, contextual, emotion-focused, solution-focused, psychodynamic, CBT, and narrative. I've put them kind of combined in a certain order so that we can look at them side by side, because Bowenian is certainly kind of foundational to family systems. Murray Bowen was really the start of genuine family systems theory. And so you see there that some distinctives of the Bowenian approach is differentiation of self, triangulation, emotional cutoff, and the idea of a family unit. Now, these others are obviously rooted in theories that work with individuals as well: psychodynamic, CBT, and narrative. And so those theories, as it relates to family systems, is very similar to their individual theories. So with psychodynamic, obviously object relations is going to be important, transference and countertransference, joining, and looking at early attachment. CBT is going to be focused on skills training, implementing systems like a token economy, operant conditioning, and Gottman would fall into CBT, as well as Ellis and Beck. And then narrative family therapy would be similar to individual, but talking about family narratives and stories, meaning making, and the idea of the zone of proximal development, which is the idea that of kind of where the family system could be without help versus where the family system could be with help. So then we have these four, which I think are kind of really distinctive kind of in technique. And so I wanted to look at these side by side. So you have strategic, structural, contextual, and experiential. And in strategic, with J. Haley, Bateson, Jackson, this was a Palo Alto group. It's a brief intervention. You're trying to perturb the system, as they said, have paradoxical interventions, suggest the problem. So you're kind of messing with the family a bit in strategic to kind of shake up the system. In structural family therapy, Salvador Minuchin, it's kind of what we think about a lot, especially when we think of boundaries, because that's very popular to talk about, written about by many people. But boundaries, alliances, making a family map, rules and hierarchy. So I think the name kind of explains there where you're looking at the family structure and trying to craft a better or different family structure to help the system. In contextual, with Bozermani-Nagy, this is really four distinctives, and so this is specifically what the theory looks at. You look for the facts, what's going on, what's happening. You look at individual psychopathologies, or psychologies, like personality and things like that. Systemic interactions, all the different relationships within the system. And then this is the distinctive here, relational ethics. And this can be applied to marriage therapy as well. So those are less about techniques and more about four areas that you're working through. And then experiential, Virginia Satir and Carl Whitaker, is very here and now, person-centered. You may do role plays or drawing. So again, these names, if you pause to think about them, really do describe what they're trying to accomplish in each of these unique therapies. And then two more, emotion-focused and solution-focused. Emotion-focused is really overlapping psychodynamic and experiential. Definitely looking at attachment. The feedback loop is about the difference between self versus others. And then they're looking for emotion blocks, kind of what's in the way, barriers to being able to connect. Solution-focused is a little bit more like CBT in a way, but they have specific distinctives. Deshazer suggested the miracle question, scales from 0 to 10, finding the exception, and certainly focusing on a solution to the presenting problem. Now, there are some specific issues related to marriage and family that are important to consider. One is crisis and trauma, and I think a couple of key things to keep in mind would be critical incident stress management is a specific way to help people and families manage crisis, and also grief models are helpful. In marital conflict, Gottman, emotion-focused therapy, and contextual, I think, have the most application to specifically couples, though certainly you could use CBT or solution-focused models as well. Separation, divorce, and remarriage, it's important to look at the family life cycle, use developmental models to think about kind of the development of the family. I think narrative is certainly a useful approach here, finding meaning in various shifts within the family system. And certainly prevention is another piece of, trying to keep marriages together and prevent separation and divorce. When you have individual psychopathology within a family, then you're really coming around the family to provide education, help them with caregiving, and help that individual get mental health treatment. With substance abuse, joining is important, finding stability within the family, helping with relapse prevention, and then I think structural family therapy is helpful with boundaries and kind of family rules and things like that. There are multicultural factors, of course, that you want to consider, things like family values, gender roles, class, race, obviously overall culture. So you want to be keeping that in mind with all families that you work with. Cohabitating couples, particularly for Christian therapists, it's important to avoid imposing your values onto them and use any of the methods that we've already talked about, depending on their presenting problem. And then LGBT families, there's kind of three areas that you might encounter. One is LGBT couples, and the Yarhouse and Sells book recommended CBT and Gottman approaches, and specifically noted research around higher levels of emotional expression with LGBT couples, and so it's effective to help them learn emotion regulation skills. Children of LGBT parents, some of the themes that you want to pay attention to are adoption stories, peer group interactions, and the role of secrets in the family identity. And then with parents who have LGBT youth, you may encounter some homophobia that you want to speak to or provide education around that, and offer support before, during, and after disclosure. Some Christian integration themes, and we'll finish with this. Sin and redemption are often talked about within marriages and family systems, offering each other grace to be a work in progress and to make mistakes, offering forgiveness, and again, that would obviously go with redemption. There's certainly a high value of marriage within Christianity, and in the Bible, the word family is used to describe God's followers, and so there's this really strong sense of what it means to be family and to be Christian, and also just what is healthy relational functioning, and certainly moral virtues would shed some light on kind of how we are to act as families, how we are to treat one another. I hope that's been helpful, and I will see you next time.